Good morning, good afternoon, or good evening, depending on where you are joining us. And welcome to the first talk in the Modeling Perspective 2025 Speaker Seminar. My name is Joana Gomes Dias, and it's my pleasure to be moderating today's session. I will start with some very short and housekeeping rules. So Rachel will give a 25 minutes talk followed by 20 minutes discussion. So we expect to end at 5 minutes to 4 o'clock European time. We encourage you to have questions and to enhance the discussion at the end. So please feel free to raise your hand at the end or post the questions in the chat during the presentation. And please keep your microphones muted during the session. Let's move. So this series of seminars is a great opportunity to bring together experts from different disciplines to explore how modeling can help us better understand and respond to public health challenges and emergencies. This series of seminars starts during the COVID pandemic and with the modeling hubs, and since then has expanded, covering a broader range of modeling perspectives and health topics, as such the ones that Rachel will bring us today. And so today we begin with a topic that is with growing importance as forecasting climate-sensitive diseases. With climate change influencing disease dynamics worldwide, the need for a robust and data-driven forecast tools has never been more critical. And for that, we are delighted to have Professor Rachel Lowe as our speaker today. So Rachel is an ICREA research professor and global health resilient group leader at the Barcelona Supercomputing Center. She also holds a Royal Society Dorothy Hodgkin Fellowship at the London School of Hygiene and Tropical Medicine. Her research focus on developing policy-relevant methodology solutions and tools to enhance surveillance, preparedness, and response to climate-sensitive diseases, outbreaks, and emerging threats. Rachel has shaped the work in early warning systems that integrate data with epidemiological models, helping predict outbreaks of disease such as dengue and leptospirosis. She has collaborated with policymakers, organizations, and research institutions across the world. With that, it's my pleasure to welcome Rachel. And so, Rachel, over to you.
Thank you so much, Joanna, for the kind introduction. It's a pleasure to be here. So with that, I will dive straight in. Let me see if I can move my slides. So here we can see a visualization showing the monthly global surface temperature increase above industrial levels between 1850 and 1900s. And we can see that decade upon decade since the 1940s, we are seeing unprecedented levels of warming. And last year, the global temperatures exceeded the 1.5 degree threshold, which is particularly concerning in terms of trying to keep the global temperatures within safe limits for human health. The World Health Organization considers climate change one of the greatest threats to public health of the 21st century. And adaptation mitigation action is needed to prevent further food and water shortages, increased temperature-related mortality, and the changing distribution, timing and intensity of infectious diseases worldwide. So in the Global Health Resilience Group, based in the Earth Sciences Department at the Barcelona Supercomputing Center, we're working to co-create different public health decision support systems using climate and environmental information together with ministries of health, environment agencies, humanitarian and UN partners to develop preparedness and response plans using sub-seasonal to seasonal climate forecasts, which can feed into early warning systems, which could help guide, for example, educational campaigns or mosquito control programs. We're also looking at longer-term projections to guide adaptation measures such as nature-based solutions, and developing data-driven models to generate counterfactual scenarios to be able to evaluate different interventions, which may include things like vaccination campaigns or Wolbachia. And we're also trying to quantify the anthropogenic footprint of climate change on the health burden of different outcomes, which could help allocate loss and damage funding, particularly towards those countries who are suffering the worst impacts of climate change. And we have many partnerships across the globe. We have many projects in the Latin American and Caribbean region. We're working with Médecins Sans Frontières and the Red Cross, with partners in parts of Africa. In Europe, we have several EU-funded projects to build tools to try and resist the emergence of certain climate-sensitive diseases in the region. And we're working on, particularly on dengue early warning systems with partners in Asia and Southeast Asia. And we're also working on a new partnership with the DHIS2 group to try and integrate some of our tools within their platform. So over the years, we've published a body of research outlining different methodologies for understanding and integrating the impacts of climatic extremes on infectious disease risk, with a focus on dengue. We have published research looking at developing tools in Brazil, Ecuador, Barbados, Vietnam. We've also done some work looking at trying to understand the links between flooding and leptospirosis, for example, in Argentina and Fiji. We also contribute to the Lancet Countdown collaboration, which tracks the impacts of climate change on health across several different sectors. And the indicators that we develop, including a climatic suitability indicator for malaria, for tick-borne disease and leishmaniasis across the global and Europe reports, have been, for example, used within Nature news articles to communicate this to a wider audience. We've contributed to several policy reports published by the Environment Agency and the World Meteorological Organization, providing examples of the kind of indicators we've been developing, and also different early warning systems in Barbados and Vietnam and different places, which can be found in these reports. And last year, a book chapter which was drafted by my group between the London School of Hygiene Tropical Medicine and the Barcelona Supercomputing Center was published, outlining some of our experiences from engagement methods and implementation of these kind of systems. So over the years, we've been working to try and improve the way we can integrate climate information into early warning systems to provide probabilistic information with several months lead time. And we do this by integrating several different data sources, including Earth observations, data from hydrological models, for example, combining this with as long as possible records of surveillance data to feed into different Bayesian statistical modeling approaches, and then using seasonal climate forecasts, which can allow us to predict climatic conditions several months into the future. We can make these forward-looking predictions up to several months in advance. We've also been working with the National Environment Agency in Singapore lately, and comparing the kind of modelling approaches that we've been developing with their state-of-the-art LASSO modelling that they're using operationally to try and predict dengue outbreaks. And recently, they've been ramping up their Wolbachia interventions, and they were interested in using the kind of modelling approach we've been generating to produce some counterfactual scenarios of how the dengue season may have evolved without this intervention. So this is a piece of work that is under review at the moment by Emily Finch, who just completed her PhD at the London School of Hygiene and Tropical Medicine. We have a Wellcome Trust funded project called ID Extremes. The goal of this project is to develop a modelling tool to be able to predict the probability of infectious disease outbreaks given compound and cascading extreme events, such as drought events followed by extremely wet events, and the impact this may have on disease risk in the coming months. So we're developing a series of R packages which will be designed to interact with the existing climatic tools that have been developed within the BSc Earth Sciences department. And we're working directly with the Red Cross Climate Center, MSF, and the InfoDengue project based in Brazil, to make sure that the tools that we develop can be integrated into existing user platforms. So based on some research that we conducted several years ago in Barbados, we identified this interesting pattern using distributed lag nonlinear models combined with our Bayesian prediction framework, which identified this increased risk of dengue outbreaks several months after drought events, but also an increased risk immediately after exceptionally wet conditions. And as is expected by the literature, around 1 to 2 months following exceptionally warm conditions. So we then verified this finding using a much larger geographical region. We applied this to Brazil, and we also interacted this and assessed the impact of this pattern along an urban gradient. And we found this similar long lag drought effect and short lag wet effect, which is actually exacerbated in the urban areas, particularly where there are increased reports of water shortages. This is an example of how we've been evaluating how well our model framework can do at predicting outbreaks over time. Here we can see month along the x-axis and dengue season year along the y-axis. And the shading represents the probability of an outbreak according to the model, and the X indicates if an outbreak occurred or not. And using this distributed lag nonlinear model approach, the model seemed to do a reasonable job, particularly in El Nino events, at detecting some of these outbreaks. But when we went to implement this in practice in Barbados with our partners at the Caribbean Institute for Meteorology and Hydrology, who produce a series of climatic services for the region, including drought outlooks, this approach is very data intensive and requires a lot of adjustments to current practice and able to feed it with all the data that's required. So for example, if we wanted to make a forecast in July for the month of October, we would have to collate observed climatic information for May and June, and then stitch that together with seasonal forecasts for July, August, September, October, and then keep updating that as we approach the target. And we realized that this is actually quite an intensive request for the climatic services. So through the PhD project of Chloe Fletcher and my group, we've been looking at different ways to be able to account for these potentially interacting effects between droughts and exceptionally wet conditions, because we feel that it's necessary not only to have a drought, but the drought should be followed by particularly suitable conditions for the transmission of dengue for this to hold. So we are exploring an interesting long short lag interaction approach, where we interact the standardized precipitation index, which measures negative values indicate drought and positive values indicate exceptionally wet conditions. And we combine this with temperature, and we're using different model selection and validation approaches to find which are the ideal short long lags for the drought indicator and for the temperature variable. Which is very similar to the findings using our DLMM approach. We find that if the conditions are warm, then the highest risk of dengue is when we have long lag drought conditions combined with short lag wet conditions. But if the conditions are cool, this relationship is less intense. So this is a framework just laying out what this might look like in practice. So if we want to make a forecast 3 months in advance, we can use the standardized precipitation index observations in the previous months and combine this with the temperatures at the time of prediction. And then we just need a single forecast for the month before our target month. And if we are to observe dry, then hot conditions and have a forecast for wet conditions, then the model, according to the sort of historical model fitting process, would indicate a high risk of dengue. Whereas if we were to observe dry conditions, it was relatively cool, and the forecast were conditions to continue to be dry, the model would indicate a low risk of dengue. And along with this, we've also been thinking about ways that we can communicate this kind of probabilistic information. So we're extracting posterior predictive distributions from our model, which we can visualize using some kind of PDF and seeing, you know, the proportion of samples that exceed an outbreak threshold. But in consultation with the chief medical officer in Barbados, they suggested this more visual and appealing approach to very rapidly communicate the risk of an outbreak according to different levels of risk based on certainty. And we've also been working through a interdisciplinary partnership to think about how we can actually evaluate and monitor these kind of systems once they're implemented, and the kind of questions that we need to ask to ensure a sustainable implementation of an early warning system. So we recently published an article by Avriel Diaz and team in PLOS Climate, laying out a set of guiding questions for both developing a model, but also implementing the early warning, particularly in terms of the different stakeholders who are involved, what capacity is available to keep this running in the long term, who will conduct monitoring and evaluation exercises, and how can we sort of communicate to the public the return on investment of this kind of system. In our group, we're developing a series of training activities. This is an example of an activity we ran in the Caribbean early last year, developing user-friendly interfaces to allow users, particularly professionals working in ministries of health or environmental hygiene and in the Met services who may not have previous experience working with R. We are developing user interfaces to allow them to interact with R code without having to necessarily install it in the first interaction with this software. And last year, the Ministry of Health of Brazil, together with the InfoDengue collaboration, launched a dengue forecasting sprint. They invited several modelling teams to take part in this exercise to try and give an outlook of how the dengue season in 2025, following the worst dengue outbreak on record in the country in 2024. So we had a go at rapidly putting together a model framework for Brazil, adapting the framework that the long short lag framework that we've been developing for Barbados and applying it to Brazil. And interestingly, we're finding quite similar patterns. And we applied this within the sprint. All the information is available on the InfoDengue web pages. And this is just an example of one of the verification techniques. This is the evolution of the dengue season in Amazonas state in 24 compared to the different model outputs. This is using out sample predictions. So the model from our team, the Global Health Resilience Group, is in orange, and it did a reasonable job at capturing what was actually observed. And the team drew up a sort of scoring table, if you like. It was during the time of the Olympics last year. And the GHR model did a reasonable job at several of the target areas and overall at predicting this. So this hopefully is promising for some of the digital tools that we're developing and hoping that will be used in different settings. And following the 23 El Nino event that went into 24, our partners, this started with through a request from our partners in Ecuador to produce some outlooks for dengue based on this El Nino event and how things might emerge. And taking advantage of our networks in our Wellcome Trust funded projects, we developed some forecasting models for both dengue and leptospirosis in Ecuador, Peru, Colombia, Brazil, and Argentina. And then we on a platform which has been developed in our Shiny, we've been translating this probabilistic information into warnings, and we're working to try and tailor these different levels of from high, medium, low, and no action required warnings into something that's actually relevant for the local settings. That's a work in progress. And we've also been producing some bulletins to accompany this this app to allow policymakers to be able to rapidly interpret the information. So the way that this works is that a forecast can be issued in, for example, in January. Typically, most of the users we work with are interested in lead times of around 3 months. The forecasting system we've developed is capable of producing forecasts up to 6 months in advance, given the lead times, although the skill of these forecasts does tend to drop off after around 3 months. So that's something else that we're evaluating. Here's an example of that sort of evaluation that we conducted in a study for a dengue early warning system we developed for Vietnam, where we're looking at the continuous rank probability skill score of different candidate forecast models compared to a baseline over lead time and across space and season. And I will skip forward to show that this is a visualization of the R package suite that we're currently developing. We're hoping that to launch the first version of these packages on CRAN in the next few months, certainly before the end of the year. So under our ID Extremes project, we're developing 3 packages. First of all, to allow users to explore their data. So assuming the user has a disease surveillance data set combined with different climatic, socioeconomic, and other indicators, this package allows the users to visualize that data and see if it would lend itself to using these kind of space-time Bayesian modeling approaches to understand, for example, delayed and non-linear impacts of climate covariates, how they may interact with different socioeconomic indicators. And then given a robust and well a formulated model that could be developed in GHR model, we're then developing a GHR predict package, which will allow the users to apply the different cross-validation methodologies and to make forward-looking predictions and allow the model to incorporate an ensemble of seasonal climate forecasts and account for that uncertainty going forward. And just this month, we started a new project called Tactic, which is led by Anna Vicedo at the University of Bern. And in that project, we're working to conduct health impact attribution studies, looking at a range of different health outcomes from mental health to infectious disease risk with partners in South America, Southern Africa, and the Mediterranean region. And we're hoping to include an additional package that can allow users to conduct attribution studies to really quantify the way that anthropogenic greenhouse gas emissions are impacting different health burdens. And of course, to conduct all these studies, we need to have robust and harmonized data sets. And through a Wellcome Trust funded project called Harmonize, we're working to develop a toolkit to integrate gridded climatic products, both reanalyses and forecasts, with strategically collected ground truth data using drones and weather sensors, together with socioeconomic and demographic data, and to be able to combine this with disease surveillance data, and to make these data sets relevant to users in operating in cities or the Amazon rainforest or small islands or highlands. So we're currently working towards developing this toolkit. We're calling our tools, that's the For Health toolkit. So we have Clim for Health, Socio for Health, Data for Health, which the Data for Health package is the package that allows a user to then integrate with the rest of the suite to make sure that line list data can be brought to the same space-time resolution as the other indicators which are most relevant for decision making. And then we're developing some more advanced packages, including Cube for Health, which will allow users to operate with data cube projects, including, for example, the Brazilian data cube, and also Drone for Health, which will be for analyzing drone images in particular settings. And this is just to highlight some of the limitations of the gridded climate products out there. So this is the ERA5 land reanalysis product mapped across several islands. So on the left, we can see this product over the Dominican Republic, which is larger than several of the other islands. And here you can pick up some of the demography, for example, of the island. This is a precipitation layer. But if we go to the really small islands, which are also particularly vulnerable to climate change, including Barbados, Grenada and St. Lucia, then we can see these products are quite limited, and we should ideally be using the ground truth meteorological station there. And then this is just a little demonstration about what can happen when you use different climatic products through some kind of health impact model. This is an example for dengue and malaria in Ecuador. And just as an example, if we are to use the meteorological station data in the city of Machala to understand dengue transmission in that city, then if there were a 1 degree increase in temperature, we'd expect a 68% increase in the relative risk of dengue. Whereas if we were to use one of the climatic products, that risk would be estimated to be lower. And in the case of malaria, we found that the meteorological station indicated a negative association between malaria and precipitation, whereas several of the products indicated an increase. So this is really a word of warning about using global products off the shelf to understand local disease transmission. So as part of our Clim for Health package, we're looking to develop ways for users to be able to load and post-process climatic data sets and to downscale them to ground truth station data. This is an example of one of our hotspots in the Colombian Andes. So we can see the orange area is our hotspot. We're installing 3 meteorological stations along an urban gradient. Then we have the blue grid indicating the resolution of the ERA5 land product of 9 kilometers squared. And the big black grid is showing the resolution of the seasonal forecast data, which is 100 kilometers squared. So we're developing tools to allow users to make the most of these global products at the local level. And if you'd like to read more about our work on harmonizing multi-source data for vector-borne disease management, we recently published this review with Claudio Codeso in the annual review of entomology. So just very briefly, I know my time is about up. I just wanted to highlight that through a Horizon Europe funded project called ID Alert, we're developing a seasonal indicator platform to provide indicators of changing climatic suitability for several pathogens of interest and importance in Europe. We've developed this platform in consultation with several users at both the European and the local level. This is very much a work in progress, and we're looking to develop a multi-model framework using a combination of threshold-based machine learning and mechanistic transmission modeling approaches for different pathogens, including tick-borne disease, leishmaniasis, dengue and other arboviruses. And we're hoping through our networks and future projects to fill this grid as much as we can, so we can produce an ensemble of different models to help make the best, provide the best outlooks we can. Initially at a seasonal timescale, but we're also looking to include projections. And this is just a snapshot of what the platform could look like. And by clicking on particular NUTS3 regions, the users can look at, for example, the suitable months, the duration of the season, peaks, and different indicators. And we have a GitHub where we would like to invite collaborators who may want to provide models that could then provide these kind of seasonal outlooks. So this is a work in progress, and we hope to develop our thoughts on launching some kind of collaborative call for populating this platform. So I will stop there. Thank you very much, and happy to take any questions.
Thank you so much, Rachel, for keeping the time and also for the lot of inspiring projects that you shared with us. And it was amazing to see how all the work goes from the data to translation to tools that you can visualize easily, as you gave some examples. So I do open the floor for questions. So please raise your hand or post your question in the chat. So feel free. So it's a friendly environment, and we would also love to hear from all of you. So maybe while you think, I can start. And
we already have, sorry, we have 2 hands already raised.
sorry, I couldn't see the hands. Thanks, René.
Maybe let's give the word to Teresa, who I think was first. Teresa, please.
Thank you. Thanks so much, Rachel, for this very interesting presentation. You have a lot of projects ongoing, really super a lot. Most of those that you gave detailed examples for are not really applied to Europe. So we are, of course, interested to see what could be done with the European data. You talked about socioeconomic factors, for example. I don't know, do you know if we would be able to get those from Eurostat, for example? And would those models also be applicable to Europe? And then my second question is related to the last ID alert and the non-cholera vibriosis, because I'm working a bit on that too. And we have the Vibrio suitability tool that we're planning to improve a bit. So we're working on that as well. So happy to hear what you have to say about that.
Sure. Thank you so much for your comments. Yes, I didn't have time to share all the details, but we are planning, particularly for our Epi Outlook platform, which has a focus on Europe, but also has scope to be applied in other places. We're trying to develop a version for Bangladesh and other places. But in the European context, we are looking to develop, for example, machine learning or statistical frameworks for diseases that are endemic in the region. We do have a machine learning approach that we developed and published last year looking at leishmaniasis in the region, and we are working in collaboration also with ECDC with data, for example, on West Nile virus and the other pathogens of concern to look to develop more data-driven approaches. We're also planning to integrate many of the Eurostat indicators, which could be relevant, also looking at the Europe database and other ways to incorporate this. These indicators may change across Europe, and to try and have a look at a bit of an inequity lens in our ID Alert project.
Okay, and Vibrio, sorry, did you mention?
Oh yes, Vibrio, yes. So within the ID Alert project, we're collaborating with the developers of the Vibrio indicator with Jaime Martinez and Joaquin Trinas from who's working in Santiago, and we are planning to also incorporate Vibrio into the platform. So we're looking at sort of seasonal prediction for both sea surface temperatures and salinity. So this is something we'd very much like to develop and have these sort of longer lead outlooks to complement the Vibrio map viewer that currently exists.
Thank you so much, Teresa, for the questions, and Rachel for the answers. So now I will give the floor to Angelo from ECDC.
Yes, hi, thank you. I read 5-10 minutes later, so I don't know if you described the model detail or if it's too long, maybe just put a link and then I will check it myself. And then I have a couple of other questions. Is this a full Bayesian model? And if it's a full Bayesian model, I saw that you have a Shiny app that you somehow deployed and it's open for the public. How do you manage the hardware requirements? Do you have some cluster computer survey, or you find a way to make it easy to run on request? I mean, because usually these models take a while to
Yes, so we're developing our tools and packages at the moment using our INLA,
Okay,
so the Laplace approximations, which makes
so it's faster.
computational, greatly reduces the computational time. For a lot of our research, we have made use of the HPCs to, run, test multiple simulations and multi-model techniques. But the packages that we're developing in R, we hope that they can be deployed using in settings that don't necessarily have so much access to high performance computing. It really depends a little bit on the questions and the size of the data sets. The R Shiny app that we have at the moment is very much like work in progress that we've been co-creating with our partners in different regions. It's not something that's open at the moment. We don't have anywhere where you can click and run a Bayesian model, but we are operationally internally producing our seasonal outlooks from 1 to 6 months ahead for the different regions.
So now we have Renee.
Yeah, hey, Rachel, thank you so much for a really great roadshow of all the model applications. I'd be particularly interested to hear a bit about how models were used and put into actions on the ground. So you mentioned, for example, the dengue forecasting in Brazil and Ecuador. Can you tell us a bit more about how the forecasting was perceived and then used? Was it helpful to adjust interventions? Did you get feedback, and was it feedback incorporated? It would be great to understand. Thank you.
Sure. So for the Brazil dengue challenge, that was a request from the Ministry of Health to the InfoDengue team, and that was a report was produced, and the different sort of estimates across Brazil have been incorporated into their plans. We have a very interesting recorded webinar about that challenge. I can share the link to that later. Also, one of our recent experiences has been in Barbados. We produced a forecast ahead of the Cricket World Cup that took place across the Caribbean islands in June, and particularly in Barbados. And our forecast was issued ahead of the event. And although there were additional plans that had been put in place to manage the very large influx of participants from all over the globe to these events, they did actually use our forecast to ramp up some of their control measures and go and revisit a lot of the stadiums. And in the end, although the risk was indicated for high, they managed to keep everything under control. So that was a very interesting example. It was also we had an operational dengue forecast in Vietnam for several years, which was an interesting experience because across the country, the different dengue control teams use different thresholds, for example, to evaluate or to make their sort of decisions and interventions. So we had a feature on our platform to allow the user to choose which outbreak threshold they may want. And that was running operationally, while there was funding. But one of the biggest challenges we're seeing of this kind of work is it's often developed within research projects as prototypes, and then the funding's cut off. So our team now, we're really working to try and build sustainable tools that can be used and implemented locally, and to conduct training courses so that local data, local knowledge can be used to keep these things going in the future.
Thank you, Renee and Rachel, for the questions. So while you think, I'm checking the chat, I cannot see questions and no ends. So we have a hand. Francesco, please go ahead.
Yes, so thank you for the presentation. I was interested in the method you mentioned to adapt the climate data from the grid to small areas as the islands. And so if you can give an idea about that. And also speaking about Europe, which data about surveillance data you use? There are maybe some surveillance data at the Europe level for vector-borne diseases, or what kind of data are you using? Thank you.
Sure, thank you. So for your first question, I can give a practical example that we used in Ecuador. So we had long meteorological records from a station that was implemented in the hospital. And we wanted to, it was for the 2016 dengue season, make an outlook that was following an El Nino event. And so we needed to access sub-seasonal forecasts, which had lead times from 1 to 11 months in advance. And we had to extract that over from a grid over the city. But we found that because the city is at the foothill of the Andes, the temperatures were a lot lower than the meteorological station. So it was actually favourable to use the grid square over the ocean just adjacent to the city, and that was much more similar to the weather station. So that was kind of some simple form of bias correction, if you like. And through our Clim for Health package, where there is an existence of meteorological station data, then we recommend conducting the different sort of downscaling bias correction approaches to be able to correct these gridded products. Of course, if you're lacking station data there, you have to make some kind of interpolation or invest in installing ground truth data in those areas. In terms of data in Europe, we are using ECDC provided data. So that is what we used for our leishmaniasis study that was published last year in Lancet Regional Health Europe. And ECDC has kindly shared with us data for several different pathogens. So we're going to be working towards developing models that could feed into the Epi Outlook platform.
Thank you for the question. Now we have a few questions in the chat. So one from Therese. Are all the models and tools freely available?
Sorry, are they freely available?
Yes.
They will be, yes. So we're hoping that the R packages should be available on CRAN before the end of the year, the GHR suite, and then our harmonized tools, they're a work in progress. We're going to be developing our first training course at the end of the year in Brazil, and then we have another training course in Peru, and we'll be collating all the materials and the packages. They'll be available on the GitHub. And yeah, as soon as they're sort of ready, then we will make sure we disseminate them widely.
Thank you. And we will also be looking forward to something in Europe. And another question here, do the models include the effect of preventive measures and how? For example, vector elimination or control by insecticides?
Mm-hmm. Yes, I mean, where that data is available, the models are flexible enough to incorporate those kind of layers. In the past, we've incorporated things like the Bretto index. We also are looking as much as possible if we can access for dengue, if we can access serotype data. That's certainly helping us predict interannual variation along with the climate drivers. If we have information, for example, funding allocated to or amount of pesticides applied and things like that, then we can incorporate that. Otherwise, we're sort of falling back on the space-time random effects in the model to capture those unobserved confounding factors. And we're also conducting analyses to see when we incorporate these additional data sets to try and the goal is trying to reduce the role of the random effects as much as possible by using things like intervention data if it's available.
So yeah, thank you so much. No and no questions in the chat. Yeah, I think we are very, very happy and glad for this very nice presentation. And for the lot of inspiring that you navigate, guide us through these projects and amazing slides. And we also like to thank the audience and the participants. So we have a huge turn up, so over 60 people joining this webinar. So a big thank you to all of you here and to you, Rachel. And yeah, thank you so much, everyone, for being here. It was a pleasure.